This week on Africa Health Check.
You know, our God is always able, but at times like this, we really need to vaccinate.
You should make sure everybody take the vaccine. Corona is real.
We analyze the role that religion plays.
Il faut que je fasse aussi une sensibilisation auprès de la population musulmane pour qu'ils comprennent aussi que non, se faire vacciner, c'est la protection éternelle par rapport au COVID-19.
In the fight against the COVID-19 pandemic. Hello and welcome to Africa Health Check, where we reflect on Africa's response to the COVID-19 pandemic. I am Khokhontlejang Paladi. On today's episode, we will be discussing the impact of COVID-19 pandemic on religion, as well as reflecting on the role of the religious institutions in responding to the COVID-19 pandemic. But before we do that, let us have a look at Africa in numbers. This week on Africa in Numbers, we highlight the countries with the top daily death rate as per the last 7-day reported average as of the 8th of January 2022. South Africa's 168 daily death is the highest daily death rate average on the continent, followed by Egypt with 24, Zimbabwe with 19, and both Madagascar and Namibia reporting an average of 13 daily deaths. For more on these statistics, log on to the official Africa CDC website. And that is our Africa in Numbers for this week. To help me in discussing the impact of COVID-19 pandemic on the religious sector, I have our guest panelist, Dr. Bashir Abdul Rahim, who's a lecturer at the Department of Religious Studies, Faculty of Arts at the University of Lagos in Nigeria. We also have our usual commentators, Dr. Marianne Moreithi, who is the current chair of the Department of Medical Microbiology and Immunology and is senior research fellow at the University of Nairobi in Kenya. Last but not least, we have Reverend Anthony Achampong, who is a pharmacist and a pastor. Before we hear from this distinguished panel, let us have a look at the word on the street.
Alors certaines églises, lorsque la pandémie était venue, il y a plusieurs qui en ont profité pour dire que c'est le diable, pour effrayer les gens, disant que cette fois-ci c'est la fin du monde, Dieu revient, vous voyez, avec cette maladie beaucoup de gens vont mourir, ça c'était au début.
Our place of worship, we've had two exercises. We've had vaccination outreach in our church. So many people turned up, even those who are not from our church. So I'd say we are encouraging more and more people to get vaccinated. It's a conversation we are having and it's being done.
Notamment dans la mosquée, comme nous sommes des musulmans, et les imams nous ont toujours prêché par rapport à ça. Et la première des choses qu'ils nous ont dit, c'est ce que les prophètes lui-même nous avaient dit, qu'il fallait se protéger. Si vous savez que vous êtes malade, il faut essayer de protéger les autres qui ne sont pas encore contaminés.
And that is the word on the street regarding the impact of COVID-19 on religion and people's ability to access their places of worship. I'm going to dive into the discussion right now, and I'm going to start with Dr. Bashir. Maybe let me give you this chance to just quickly introduce yourself and tell us where you're from.
My name is Dr. Bashir Abdul Rahim. I am a lecturer in the Department of Religious Studies, Faculty of Arts, University of Lagos, Akoka, Yaba, Lagos State, Nigeria. I teach religious study over a decade in the faculty. So I'm a lecturer one, and I have publications in both local and international journal. I involve in religious activities by giving lectures, public lectures, as well as on radio and televisions. On the university campus, I am also Deputy Chief Imam of University of Lagos, which means I do deliver sermon on every Friday, which is part of my responsibility as Islamic studies scholars. Thank you very much.
Thank you very much, Dr. Bashir. And maybe just give us a little bit of a context, a background on how do you find yourself as a lecturer in the religious studies? What is the story behind there?
Interesting. My life has been in religious studies. My father, of the blessed memory, was a great scholar, a Malam. So all my primary education is from religion. I learned the Quran from my father. In 1976, I traveled to Kaduna, northern part of Nigeria. I spent 9 years there learning Quran and other discipline in Islamic studies.
Thank you so much for sharing that. Congratulations on all your achievements. And I think given your wealth of knowledge, experience, we're really honored to have you as part of this conversation. Maybe let me just start off the discussion here and saying, from your perspective, what would you say has been the impact of COVID-19 on the religious sector holistically?
Well, it has, every one of us, we understand the effect of this COVID-19. Yes, not only in Nigeria, as you know, that all over the world, but the case of that Nigeria is special, it's peculiar. No, let me start. I'm going to look at it from different angles. Let me look at it from the angles of worship, going to mosque. In Nigeria, yes, we have some Islamic cleric. This Islamic cleric, the majority of them, they don't have a paid job, but they are always in the mosque, to call to prayer, to lead people in the prayer, and they are not being paid. Okay, so I will come to that one later. But let us look at how it affects religion. This thing happened in Nigeria. We have our first lockdown around March 2020. That's when we have our first lockdown, and it took a whole month. So that one did not give us as freedom to go to mosque. So we started observing Salat in our homes. So all mosques were locked throughout Nigeria. Nobody was allowed to go to mosque. No any imam was allowed to go to mosque. So that one took almost 1 month. So this affected a lot of activities that were supposed to go on. For example, in every mosque, it is expected that imam should give a little sermon. So with that period, all those ones stopped. And that's number one. And number two, those that are some Muslims, they are very weak. But by listening to the lecture or call to prayer, that encourages them to come to mosque, to come and pray. But during that period, such people, they stopped coming to the mosque. They stopped praying because there was no anybody to encourage them. That are practicing Muslim, that are weak Muslim, that they can only come to mosque to pray if they are being sensitized. Immediately when there's no sensitization, they'll forget about coming to mosque to pray. So we cannot avoid that. We have some Muslims like that. So at that period, such a thing stopped. Such people, they stopped coming to mosque to come and be praying. In that aspect, it was a pandemic, COVID-19 pandemic really affected religious practice in that aspect. So not only that, when the restriction was lifted, so we started going to mosque. But the problem we have with the mosque is this. They said that, social distancing, using of face masks, you understand? So, yeah. I'm living in a rural, in a community, not in a community that majority of people were not educated. To the sense, some people, they didn't believe that there is a COVID-19. They were saying that they have never seen anybody. Look at all of us in our community. Have you ever seen anybody being affected, being contacted with this COVID-19? It's a lie, nothing like. So such people, they're very difficult to convince them. When they'll be arguing with you, they will ask you a question. Show me somebody that you have seen. Just tell me the house, the number, the house number of that person will go there. So we need to be educating them this thing. So therefore, coming to the mosque to observe Salat, there is a way by which we arrange ourselves. It's a part of condition of proper observing Salat. That is, you have to come together. We stand shoulder to shoulder. The scholar, because of that social distancing, they say we should not do that one in the mosque. Let us keep social distancing.
Absolutely. Maybe just to jump in there quickly, Dr. Bashir, sorry not to cut you short, but just to jump in, maybe briefly share with us that during the time when you had the lockdown and movement restrictions, how did you ensure that people still get the religious guidance and support that they need? What are some of the initiatives that you undertook to still make sure that you reach out to your followers and people who are of the same religion?
Actually, during that COVID-19, all this religious gathering, we stop it. Lagos state government do not allow us to do that.
Mm-hmm.
And the Lagos state government, we have a league, we have association. So our association were invited, the leaders of this association were invited by Lagos State, as well as the Christians, they were invited. And the government sought collaboration with us, that we have to collaborate with the government by making sure all these social gathering, we should put a stop to it. So at that particular point in time, no social gathering was allowed, and no any affair did go to social gathering. That is why I said that it affected a lot of our fasting. We normally have that social gathering. We have some of these affairs. That's where they normally get their means of livelihood. People give them charity. So because of 2000, there was no any form of Ramadan gathering. And then it really, really affects economy of this affair, because they don't have any source of income except staying in the mosque, praying to the people, give them charity. But in the Ramadan, they normally have a harvest in that Ramadan, because the gathering will be allowed, they'll be moving from one place to another. But 2000, they did not allow them. And nobody, any one of them even attempt or made an attempt to do that. So in that aspect, it really affected them, and they complied with government, with state government, or not only state government, federal government initiative, that no any social gathering, either religious or another thing, should not be allowed. And then all of us in Nigeria, we comply with it, and it affected the economy, the source of income of Muslim clerics.
Absolutely. We've had on our previous shows, we were talking about the effects of that on the economy. So we do understand how, although it was about flattening the curve, it also had adverse effect on people's livelihoods. I'm going to jump to Reverend Achampo. Maybe share with us how you mitigated the challenges that came with COVID-19 as a pastor, and how did you ensure that you still provide the religious guidance and support that people need while complying with the restrictions?
Yes, Gigi, COVID brought many woes, as Dr. Bashir has alluded. And in my part of the world, that is in Ghana, for many of those who could not go to work or were not working, the church embarked on a very good, what I call social interventions, to provide welfare packages to people like those in orphanages, and then in their own churches also undertook the responsibility to care for the poor. I personally embarked on an initiative to raise a lot of money for an orphanage that I know, and then in my central church and all other branch churches, we took it as a responsibility to help our people. That is one of the things that the church did, or faith-based organizations, as I know in Ghana, they did towards the poor in their own churches and then in the communities where they operate. So that is one of the things that they faced. There are other issues that are still difficult to handle, because there was a national directive by government that those who meet in classrooms, rented cinema halls, residential areas, could no longer meet to worship. And until now, many churches have been wiped off, many faith-based organizations are non-existent, and which is a real blow to the nation. So that is how one of the ways that a church could help people in the instance.
Absolutely. I'm going to go just to Dr. Marian. I know that you are a person who has a very strong religious footing because you did give us a Bible verse a few episodes earlier. Just share with us, what was your experience, as a follower? How did you access religious services, the moral guidance and support that you needed during the COVID restrictions, particularly lockdown and movement restrictions?
Yes, being quite deeply rooted in my religion, we found that it was quite unsettling not to meet every so often with fellow congregants and also with our spiritual leaders. But what came into effect, knowing that we need to social distance, we need to wear masks, at the point where we didn't have vaccines, we went virtual. I would meet, listen to the priest virtually. If we had a baby being baptized, which is also something that we need to do. I think you even saw some pictures where babies are being baptized from a distance, where the priest would hold a water gun, literally a water gun, and pour the water over the baby. So I really commend the religious leaders for thinking out of the box and thinking very quickly, because without that, we then have resort to people either having some depression or the other, because we need these social interactions to even feel human again. So that was something that came into effect. But what, as a country here in Kenya, the government listened, sat down with the religious leaders and came up with measures on what the church needs to do. They increased the number of services in a given Sunday, made sure the service could only last 1 hour, just to make sure that we're meeting physically. Made sure that before we entered the church, there was some mitigation where temperatures were taken, people washed their hands, there was sanitization, there was no receiving of the Holy Communion because of, again, exposure, but it allowed us to meet frequently, get that spiritual nourishment. So for me as a scientist, I felt it was safe for me to go to church, bring my family, and encourage other people to come in when they felt comfortable. Made sure we had caution for people who are a bit older, who are a bit vulnerable. Maybe they continued getting their spiritual nourishment in different formats that were made available. So that was my plan at that time.
Thank you so much for that, Dr. Marianne. We are going to hear a little bit of this on the other side. Now we're going to go for a short break and hear what people on the street had to say about this. We're going to continue on the other side.
In churches here in Botswana, we are taught to always abide to the protocols of COVID-19 by ensuring that we sanitize, ensuring that we wear our masks everywhere we go, and ensuring that we maintain social distancing.
Nasikia kama wakubwa wetu ama viongozi wetu, imekuwa ni tangazo kwa kila mmoja ajilinde na apate chanjo kwa kila mshirika, na uwezi ingia kanisani bila mask. Hiyo ni masharti yenye iko mahali huwa ninashiriki.
Dans mon lieu de culte, le COVID-19 a été qualifié d'un fléau, d'une colère de Dieu qui a puni l'iniquité des gens, par exemple.
And that is the word from the street. We're going to continue with the conversation with our panelists for today. And remember, we are discussing the impact of COVID-19 on religion. But for this segment, I want us to talk a little bit more about what has been the role of the religious sector in responding to COVID-19, because we know various communities across Africa have played a really pivotal role in disseminating information and just helping people to support their livelihoods during such a difficult time. So maybe each of my panelists can share from their countries what has been the respective, the role of the religious communities in responding to COVID-19 rather. Let's start with Dr. Bashir. What has the religious community in Nigeria been doing?
Okay, alhamdulillah. Yes, I like what my colleagues, pastor said from Ghana. So number one, that COVID-19 gives us opportunity of making people closer to God. We know as a Muslim, we normally perform ablution before we observe Salat. So we are now using that one that we can see what Islam has done for us, that we need to maintain hygiene, both everything. So we started with that one. Apart from that one again, that some majority of our members in our mosque, they are somehow those who live from hand to mouth. So it was very, very difficult for them. So we took money from the pots. So we started buying food and started sharing that food for the people around us, whether they are Muslim or they are not Muslim, anybody at all that we know that the COVID-19 pandemic was biting for economically serious for them. So we did that one. So not only that, we tried to educate them. We tried to educate them about the COVID-19, what they're supposed to do. You understand? So we did all those one. So that's what we did throughout that pandemic, just to educate Muslims. We cannot forget that some people they were still adamant because of their level of education. They didn't believe in that one. We tried to convince them. There are some mosques up to that moment. There are some mosques that they didn't observe social distancing, but there are some mosques they observe that social distance. Up to this moment, there are some mosques they still observe that social distance. Up to this moment, that there is attendance register. When you want to get it, they will give you like a number, so to know that number, in that attendance register, name, your phone number, your home address. So they comply with the COVID-19 instruction that they have attendance register, and then the Salat was observed batches by batches. So they will give them the number. If it is up to 50, so you say you cannot come, just wait for another thing. So it gave us opportunity of reaching out to some Muslims and to educate and to know the importance of religion in our life.
Absolutely, really noble gestures. And given how religion really influences our livelihoods, how better or who best to hear the COVID messages from than our religious leaders? Let me go to Dr. Mary Ann. Maybe you can share with us what were congregations doing in Kenya to support the COVID-19 response?
So congregation as well were quite receptive in the church needs. Again, I'll give you an example. I'm a Roman Catholic, and because we have priests who live in a certain area within the church, we made sure that the priests were well provided for in terms of food, in terms of all the services they required. And now that, allow me also to mention also what the church has provided apart from spiritual nourishment from where I am in Kenya. The church has been at the forefront in educating and reaching people on first the measures they need to take to continue to keep safe, and two, the government and the Ministry of Health have used the church to drive home the message that vaccines are safe, vaccines are good. And if you come around, you look around Kenya, you look around the communication coming out from the government, they're using religious leaders from the mosque, so the imams, the priests, the pastors, the nuns, they're on posters showing that they have had their vaccines and they're quite safe to do so. Remember, in Kenya in particular, the church has a very huge voice in influencing how people see situations and address them. So I was really proud when I saw that communication messages coming from the Kenyan government, the Ministry of Health, medical doctors trusting. There's this issue of we are all trusting one another to drive home the message that vaccines are safe. Two, we also have in our churches being used as vaccination centers. On any given Sundays, the church has identified that most people are free. So they're giving their vaccination camps within the churches. People come in, they're free of charge. And with that, they also get some spiritual nourishment as well. So kudos to the church within the African continent and also the people for listening to the calls. So yeah, so it's a two-way street with the church and also with the people around us.
Absolutely noble indeed, Dr. Marianne. Maybe let me go to Reverend Achampong. You can share your experience in Ghana on how the religious sector supported the response to COVID-19.
Yes, Gigi, I believe that faith-based organizations, and in this particular case, the church, has come to accept that we are a big player in the national fight against COVID. And therefore, there are certain initiatives, very commendable initiatives that are ongoing, which have been contributing to the fight. Dr. Bashir has spoken on education. And I would say that the church in Ghana has been the greatest enforcer in the application of hygienic protocols to deal with COVID. You go to any church, you have signboards, indications, no mask, no entry. And you enter, they have all things there to wash your hands, sanitize, take temperature, and even record their names and addresses for possible contact tracing. And it is ongoing, very strict, all churches, all faith. And the last and probably the most commendable thing that the churches have embarked upon is to come into amicable partnership or collaboration with government and the health service. So where the churches organize people for health officials to come and vaccinate them. I believe Dr. Marianne will be excited about this, that churches are going to government and the health service and saying to them, we have our people ready, will you come and vaccinate them? And that is ongoing. So these are some of the things that are going on in Ghana, and I believe will continue to go.
Absolutely. Thank you so much for sharing that, Reverend. And we're going to wrap up now because we've come to the end. Thank you very much, Dr. Bashir, Dr. Marianne, as well as Reverend Achampong for your contributions, as well as sharing knowledge, inspiration, and what is happening in your countries, respectively, regarding what religious institutions are doing to contribute to the COVID-19 pandemic. I believe that we've all learned a lot, and I really want to genuinely take this moment to thank all religious affiliations for their contributions to the COVID-19 pandemic. Thank you for taking up your social responsibility, and please do continue the wonderful work that you're doing because we are still within the pandemic. We have come to the end of this week's episode of Africa Health Check. Make sure you connect with us on all our social media platforms. We would love to hear from you. Until we meet again, same time, same place. The future is Africa, the future is today.